In this brief segment, we will highlight the following: a basic overview of heartworm disease, how it is detected, how it is treated, and perhaps most importantly, how it is prevented. Hopefully with this information, you will be able to make informed and caring decisions concerning your pet. We will begin with an overview of heartworm prevention in dogs. There are many safe, convenient, and effective heartworm preventives available. The oral medications HeartGuard Plus, Iverheart, Interceptor, and Sentinel offer heartworm protection combined with intestinal parasite control. Sentinel also includes a medication that aids in controlling fleas. The topical preparation Revolution prevents heartworms, kills adult fleas, ticks, sarcoptic mange, ear mites, and some intestinal parasites. The American Heartworm Society recommends that annual heartworm tests be performed, even on those dogs that are on preventative. Occasionally, a pet may not ingest a full dose of a preventative. The pet's weight may have varied, or inconsistent absorption of medication may have occurred. A simple blood test will be performed during your dog's annual checkup or as your veterinarian sees necessary. Heartworms cause disease which is severe and can be fatal to dogs. The disease is the result of heartworms living in the dog's heart, lungs, and bloodstream, with a significant population of adult worms inhabiting the heart and lungs. Heartworms are parasites that are transmitted by mosquitoes. The disease can be caused by just a single bite from an infected mosquito. Let's follow the disease process from the point at which the mosquito bites the dog. When the dog is bitten, large numbers of heartworm larvae pass in the bloodstream. This larvae develop into adult heartworms over the next 4 months. Adult heartworms are smooth white worms that approach 6 inches in length. They predominate in specific areas of the heart and lungs, and it is here that clinical symptoms begin. Because the worms block blood flow in the heart and lungs, symptoms can vary and may or may not be apparent. Coughing, labored breathing, weight loss, and a distended abdomen are some of the more common symptoms of the disease. When these symptoms are present, the dog has had the disease for quite a few months. Diagnosing heartworm disease before symptoms develop offers a much more favorable prognosis. There are 2 types of tests performed to determine if a dog has been infected with heartworms. A sample of blood can be microscopically evaluated for the presence of microfilaria, or baby heartworms. This type of test is not always 100% accurate. Adult worms may be present without the microfilaria being present in the blood. This is called an occult or hidden infection. Adult heartworms can be detected by serum tests that identify the chemicals produced by adult female worms. This is a much more accurate test for the presence of heartworms. If a dog is found to have an infestation of heartworms, then it is necessary to rid the dog's system of these harmful parasites. The primary treatment used to kill adult heartworms is a product called imiticide. The administration of this arsenic medication consists of a series of deep intramuscular injections into the back muscles on either side of the spine. Before a treatment regimen begins, the veterinarian will evaluate your pet to determine the severity of the disease, as well as the dog's health status for handling the treatment protocol. This evaluation includes a thorough physical exam, blood tests, radiographs, and sometimes even an ultrasound evaluation. The information obtained by these tests allows the doctor to develop the appropriate treatment plan for your pet. Following the 2 to 3 days of hospitalization for the initial treatment, there are some critical steps that must be taken to help ensure a successful outcome. Minimizing exercise is extremely important for the first month or 2 following the initial treatments. Exercise might lead to a rapid dislodgement of dead adult worms into the circulation, causing potentially life-threatening complications. Strict confinement to a crate or small room is necessary. 1 month after the initial treatment, medication to kill the microfilaria or developing heartworms is administered. This often requires a short hospital stay to observe the patient for adverse reactions. It is now safe to begin the dog back on heartworm preventive. 1 or more heartworm tests may be needed to ensure that all the heartworms have been eliminated. Understanding heartworm disease and how to prevent it is crucial for a dog's health and well-being. Now that you are informed, you can provide your dog with the prevention she needs to stay safe for years to come.